Welcome to Marney Reid Presents Connect to Develop, where we provide insight from healthcare leaders on the hottest topics and trends.
Well, listeners, it is a big treat to introduce you to Drs. Alex Butler, spine surgeon at Lenox Hill Hospital in New York, and Dr. Nana Sarpong, hip and knee replacement surgeon at Columbia Medical Center in New York. Welcome, gentlemen.
Thank you, Marnie. Thanks so much for having us. Been looking forward to it.
Absolutely. This is going to be great. So one of the definitions of confidence is a feeling of self-assurance arising from one's appreciation of one's own abilities or qualities. So you both are early in your career surgeons. I had the opportunity to meet you either when you were a resident or fellow. You're at very well-regarded institutions. You have been through the training. And the reason why I brought you both on here for the topic today is from the get-go, I think, Nana, I met you when you were maybe a 3. From the get-go, I just noticed this very quiet confidence about you both that is very prevalent in just your presence without even saying anything. So can you define what confidence means to you and how it's impacted your journey through medical school, residency, getting matched at these top institutions for fellowship, and ultimately landing at the academic centers that you're at today?
Thanks, Marnie, for hosting Alex and I on this incredible podcast. Looking forward to a great conversation. I've known you since I was a PGY3, like you said, and it's such an honor and a privilege to have you as a friend. And, I appreciate your mentorship throughout my journey. So to answer your question very briefly, and I'll let Dr. Butler give his take on it too. From my perspective, I think confidence is really a belief in yourself, your abilities, and, perhaps it's a feeling of assurance or self-assurance, and can be accompanied by a sense of certainty about something that you'd like to do, an action or an outcome. And it can really relate to trust or faith in something or someone. That would be my 2 cents there.
Yeah, that's great. I think and thank you again, Marnie, for having us. In thinking about this invitation, which I was flattered to receive, and the topic, which is confidence, I don't know if, Nana, you noticed this, but I went through this funny little mental process of, wow, I'm being asked to talk about confidence. We personally don't always feel like the most confident person. I guess like the external appreciation or demonstration of that can vary. And I think that's one of the things I'd like to talk about with both of you guys. But I think, the definition that you proposed at the beginning, as well as Nana's what you just said, I agree with both of them. I think, confidence, I think it's important, as I've been thinking about this, to step back for a second. And confidence, I think what we're talking about really today is self-confidence, right? That internal process. Whereas confidence, to me, that can be in an external process or event or something. So it's like a trust or reliance on someone or something that's going to happen. So you can have confidence that the stock market's going to go up for whatever reason, or confidence that a friend is going to be there to help you, or anything external to you. But it's really like this self-confidence or self-reliance that we're talking about. And that's a totally different process, right? Because a lot of the inputs are coming from you or your own appreciation of your abilities or processes. And that's a very internal process over which, in theory, we should have control over, but it can be much more complicated than that. And of course, layers in, instead of just your assessment and judgment call based on these external inputs, it layers in the different filters that we all have just as a result of human nature as far as that self-assessment process, and then having that confidence or not in what we're able to do. So I think the way I've been thinking about it, to sum all that up, is what people perceive as self-confidence is really just an outward expression of the internal assessment of our own aptitude for a given task or challenge or whatever it might be.
That is a great quote, Alex. I may have to put that on a coffee cup. There are theories out there that confidence is this je ne sais quoi that you either have or you don't. I don't necessarily know that I agree with that statement, and I found a study titled, "What Do Reinforcement and Confidence Have to Do with It? A Systematic Pathway Analysis of Knowledge, Competence, Confidence, and Intention to Change." And they looked at the ability to develop confidence through your competence in a skill set, and then the impact that confidence has on patient care. So that being said, with experience and gaining all of that, and therefore acquiring more confidence, What role do you both feel mentors and your training played in the confidence you have now, enabling you to transfer that confidence to your patients and patients' families so that they trust you to care for them and their loved ones, as well as the confidence you have to guide the patient care teams?
Thanks, Marnie. Yeah, I think that's a great question. I think to your point earlier, confidence, it's both nature and nurture. Obviously some people may seem to have an innate confidence from a very young age, perhaps due to personality, how they were brought up, perhaps even due to genetic factors. But I also do think it can be developed, and, similar to how people take courses on, public speaking, there are courses that will allow confidence to be nurtured over time through various experiences and practices. And so to answer your question, how have my mentors sort of helped build my confidence with time? I would say, through, for example, receiving things like positive reinforcement, seeing success, being able to see me navigate, tough, challenging situations clinically and surgically, and giving me positive reinforcement after that. Learning new skills, for example, setting and achieving goals and achieving and gaining experience in different areas also obviously, helps to boost confidence.
Alex, I'm going to flip this question. As someone who is an attending surgeon, you now have residents, you have fellows. How do you feel that your role as an informal mentor to your trainees plays in helping develop their confidence?
Yeah, that's a great one. And that's a role that I think as I've transitioned into attendinghood is one that I feel lucky to have. And also I take pretty seriously because having been fortunate to have some really great mentors along the way, I think I've benefited tremendously from their input. And now I'm in that role, which is, I view it as a responsibility. It's a great one, but it requires some active participation on my part. So I think, first of all, to your question about nature versus nurture, it's a fascinating thing. I mean, Nana and I are both enjoying kind of early fatherhood here. So I think we both agree that there are probably some things that are just baked in somehow as far as traits or tendencies, whatever. But I tend to really view that the nurture component is probably more significant, whether that's right or wrong. If you think you're just wired to be a certain way, for better or worse, even if that's correct, ultimately, there's probably more upside to erring on the side of nurture, because worst thing that can happen is it's not the case and you try to change and it doesn't really work out. But if you maintain that acceptance that perhaps some things can be malleable, then I think it empowers you a bit to perhaps become something that you don't view yourself currently, or achieve an identity that you don't presently have for whatever reason. So I do think that self-confidence is very malleable, whether it's me or the residents that I'm helping to work with or train. And I think each step along that process that I sort of proposed can be changed potentially. So has your aptitude changed? Like as a resident preparing for cases and going through different steps, has their ability to do those well changed? Then, okay, potentially your self-confidence can change. And then their assessment of that aptitude. So do they have the self-awareness to realize what they're improving on, what potentially needs more work, the types of things that they're reading or people that they're talking to, is that having a positive influence, or could that be changed? So that sense of awareness is really important. And then finally, the way you express it. So your outward sort of distribution of that internal process, have you changed that at all? The way that you carry yourself, the way that you speak to staff, the way that you speak to patients. And if any one of those things have changed, then yeah, your self-confidence has changed. So I do think it's malleable, and I think taking ownership over each part of that process is really important. So that's something that I, certainly not feel that I'm entirely proficient at yet, but something I have been recently mindful of over the last couple of years as I've transitioned into this role of being responsible for that type of development of trainees.
Now, there may be some listeners out there who are wondering why I picked orthopedic surgeons to talk about confidence, when one of the last things you think about when you hear ortho is a lack of confidence. But there's a difference between confidence and arrogance. Can you both share with us how you feel that these two differ, and especially how the impact on either confidence or arrogance can have on the teams around people that display these, and even these two different types of people's overall career trajectory?
Yeah, it's such a good question. And it's a fine line, I think. People, patients or colleagues or anyone, I think inherently respond very well to confidence, but respond very poorly to arrogance. And that can be a very fine line. I think the kind of transition between the two is likely most related to that outward expression, right? Like if you feel like you are up to the task and you know your abilities and you're aware of them, but if you're pulling the lever too hard to make sure that everyone around you knows that, that comes across as arrogant. And I think what people infer from that is that there's some underlying layer or factor that's making you feel the need to do that. So it potentially clouds their judgment of the things that really matter to them, which is your ability to take care of them or interact with them in whichever way is relevant. So I think really focusing on your aptitude and awareness, I know I keep going back to those two things, but focusing on actually what matters to that person and to you in the relationship or interaction, whether it's the patient or otherwise. And then almost just being a little more passive in the way that external presentation comes to bear. I think you're maybe too aggressive in feeling like you need everyone to know how great you are, etc. Even if you're great, even if you're the best, then it's not always well received. So maybe just allowing that to kind of do its own thing and focus more on the concrete or the foundation, if you will, as far as what may allow that external expression to just arise more naturally. I don't know. It's a difficult thing. And I think I've seen both sides of it in people that I've trained with or colleagues. Nana, what do you think about that? Kind of the line between arrogance, confidence, people that you've observed, kind of what affects the way that's ultimately perceived by people?
Yeah, I think you're absolutely right, Alex. I think it's a sort of fine line that can be hard to navigate sometimes. But I think sort of tangible ways to help navigate that line. Number one, that's helped me, at least, going into 3 years into practice, portrayance of being arrogant is to, one, listen actively to the patient. And so really, get in the room, take a seat, instead of standing up and watching and talking over them, have a seat and, speak eye to eye with them. Show them that, you really value their input, avoid interrupting or dismissing their concerns. And so, traditionally doctors have been, knocked for interrupting their patients within 20 seconds of, engaging in conversation. I think another way to avoid this portrayal of arrogance is just, be humble. Your general demeanor when you go into a room is to portray a humble demeanor versus one that is arrogant or dismissive. And then, use inclusive language that implies that you're on the same level. You don't want to imply that you're more superior compared to your patient. And then, ultimately focusing on collaboration, emphasizing that this is really a teamwork and collaboration to achieve the best outcome for your patient.
Yeah, I think that's a huge thing. I think listening and being attentive just conveys that, your assessment of your own time and importance is no greater than theirs. And then that shared decision making. So providing options, being honest. Yeah, I totally agree. I think those are really important.
I really like the concept of the inclusive language, the act of listening. I would love to hear some examples of people you admire who display that balance of leadership and confidence and how that impacted the leadership style that you took as you went into practice.
I would say one thing I've observed in people that I've trained with, one particular example, two separate surgeons on paper, very similar, technically excellent, but their approach and the way that they were viewed, I think, by patients or colleagues or just other people, kind of spilling over into the personal side of life. I think one of the main factors that differed was a focus on either an external sense of purpose or duty or responsibility versus more of a focus on the self. And this, we can go down a whole rabbit hole on this, but focus on the self, it's like, in my opinion, kind of wired into our human nature, but comes up time and time again in different philosophies or religions, etc., that it's ultimately the cause for a lot of kind of personal difficulty and suffering. And so if you can externalize that focus or that sense of importance via purpose or duty or responsibility to other people, then you kind of view your abilities, what you're able to do, as useful to them or to the group or to the greater goal, etc., as opposed to potentially useful to you in a certain circumstance. So how can I book another case or get another award, or what's it going to mean for me? All these kind of things, these thoughts that we all have, they're very inherent just to the way that our minds work, I think. But the differentiating factor is those that can find some value and meaning in a kind of greater purpose and use their abilities and the process of improving their abilities whether it's clinical, surgical, administrative, like you mentioned, as valuable to other people external to themselves. I think that's one of the kind of taking two big steps back, perhaps, one of the common denominators in folks that can be sort of that inherent and effective leader and have the perception from others that matches that. If that makes sense.
Yeah, kind of talking about servant leadership, which is, being purpose-driven, duty to others versus more opportunistic, right? I'm going to do this because it's going to, help me get that next award, that promotion. It's going to make me look good, that kind of stuff.
Yeah, I think Alex said it very elegantly. I would say that, quietly confident people, usually not overtly vocal, they tend to let their actions actually speak versus them bragging about their accomplishments. And they demonstrate their confidence really through their behaviors more so than anything else. And they're usually results driven, so I can think of a mentor, one of my partners right now, who is an excellent hip surgeon. And, he is not an egotistical person at all. And there's a reason why, so many hospital employees, come to see him in a consultation because of his sort of demeanor. And he exemplifies what I think you're talking about, Marnie, this quiet confidence.
That's funny. There's this fellows course I used to attend when I was in the industry. And every year in one of the talks, the course chair talked about how one of the best ways to build your practice was to be kind, learn everyone's names and ask about their families, and not to be an asshole. So funny that it needs to be said, but I guess so. On the days that you're run down, and you're about to walk into a busy clinic or you're about to walk into some really, complex cases and everyone in the room is looking to you to guide them, what do you two do to gain your confidence, even if you're depleted in your own energy stores?
Yeah, I think trying to improve, maybe maintain my own physical, mental state is a big thing for me. I've tried to focus on the last few years. So the same old boring stuff that works, right? Sleep, exercise, stress management, stuff that we've talked a bunch about, Marnie. I think maintaining that bandwidth to deal with the great days and the challenging days, etc., and just investing in a little kind of self-care and maintenance in that arena. I think in our field historically has almost been frowned upon a bit as kind of a selfish use of time, or you could be doing this or that or whatever. But I view it as pretty critical to making sure I'm bringing my best self to whatever challenge awaits. So I think taking a little more ownership over that ability is important, just day to day, week to week, etc. And then, on the days when you have that challenging case or everything seems to be happening at once and you just have to focus and perform, I think relying, a lot of the things we've covered already, relying on your training. Have you done the work, to be there and do everything that you can to make sure that your abilities are what they need to be? And if you can day after day answer that question affirmatively, then, you're bringing your best to each situation. And so whatever your best might be, you can almost kind of detach yourself from the ultimate result, because if you've controlled the things that you can control and do the things to invest in yourself, both in the short and long term, then all you can do is bring your best to each situation and then live to fight another day. But it takes effort for me, for sure. It takes an active involvement in those processes and I'm far from perfect in doing that all the time, but it's definitely something that I think you have to be involved with and make time and energy for. Because it's very difficult to just do that passively. I'm sure some people can, but for me, it definitely takes effort.
They say the first step is admitting it's an issue.
Yes, you got it.
I couldn't agree more with your last sentiment, Alex. I mean, we're all going to have challenging cases, right? If you've got a day where you've got 4 or 5 cases, perhaps, and, one of them doesn't go well, you have one other case. You've got another patient with you, who needs your all. And so we've got to find sort of practical ways that we can, help ourselves, get back to our baseline confidence to be able to deliver what, we had ultimately, promised the patient. And so I think for me, at least, ways that I gather myself if I ever get into a situation, of a challenging case, and just practically, I would say, practice deep breathing exercises. That's tended to work really well for me. It sort of helps reduce the stress level and anxiety going into another case. I think it can in turn help you, focus on the case ahead. And I would also say, you should try to challenge any negative thoughts. Forget about the last case. One of my mentors in training would say, you've got 24 hours to dwell on, something bad that happened, and then let it go and then focus on the positives. And I think if you can approach it with that perspective, it's going to make it a lot easier for you from a mental health and well-being standpoint.
We have just entered into what, quite frankly, has been one of the best topics that we added to the nonprofit Foundation for Physician Advancement that you both are involved in, which is burnout. This was something that our course chair from the New York program last year, Josh Rozelle, was adamant about adding in. It was one of the best panels I've ever observed, I think. And it was really cool because what I'm starting to see a theme along these interviews, especially when talking to surgeons, is there's this concept of self-awareness of addressing burnout no one's actually said the burnout yet on any of the interviews, but this understanding that you are not a machine, that you're a fallible human that needs time to decompress. Can you both talk about the genesis? Because when you both started in medicine, I don't think that one talked about self-awareness, burnout, self-regulation. Can you both talk about how medicine has changed for the better, hopefully, to address this since you both started?
Yeah, I think there's been a really pretty phenomenal kind of frame shift in the way that this is talked about, the awareness, et cetera. And I'll say that with some, speaking from a relative naive perspective, in that I think a lot of that change has happened as Nana and I have come through practice and now starting over the last decade or so. So the environment that we're used to is different than it was previously, of course. But I think in, speaking to mentors of mine and senior colleagues, et cetera, I think there has been a really significant, pretty remarkable change in the way that this is viewed and spoken about. There's a few things like that we can point to in healthcare, like, the awareness and change in smoking rates, et cetera. Like that was a huge success, took a lot of time. And I think this is kind of up there as far as the success and the rate with which such a significant, pervasive, epidemic of sorts. I think it's safe to call it that. If you look at rates of depression, anxiety, suicide amongst physicians, it's really alarming. And the fact that there are platforms now to address it and speak about it with other people and to develop that sense of self-awareness and acceptance that, listen, like you said, you're not a machine. It's not all in and out. There's all these internal processes that affect the way you respond to your environment and stress and when things don't go well, as Nana was explaining. So it's somewhat cliche, I think, at this point, which is a good thing in that there's been a phenomenal change. And I feel grateful to have entered this field and kind of started my practice at a time where I think that sense of importance on taking care of yourself, kind of reflecting, and also being able to let go of some of the self-judgment and deprecation that can come from feeling things that are not wonderful and awesome and potentially self-confident every day. I think it's been phenomenal and something that I feel very grateful to be a part of now as a young physician.
Nana, one of the things that I feel like when I look at you and I think, man, that guy has that je ne sais quoi, that confidence is your outlook. You touched a little bit about, your mentality is your choice. Let things go, especially in the moment, or if you need 24 hours. If, in all transparency, if I'm ever at a conference and I know you're there and I have an interaction that makes me feel a certain way or something, one of my first thoughts is, where's Nana? I'm going to go find him. He's just going to make me smile. Do you feel like that state of mentality not only helps translate to, just an air of confidence of people wanting to be around you, but also of reducing burnout?
Yes, Marnie, I totally agree. I think sort of having a positive outlook and trying to, again, challenge the negative thoughts or negative perceptions that can perpetuate burnout is definitely something that, I think can easily be done. Try to think more about positive thoughts, focus more on the strengths and achievements rather than, dwelling on any potential shortcomings. I think, being kind to yourself and avoiding the harsh criticism, which we all inevitably do. I think as orthopedic surgeons, and Marnie, you have a very similar personality to, a lot of orthopedic surgeons that I know, type A, go-getter. I think it's okay to acknowledge that it's normal to have ups and downs and to treat yourself with the same, compassion that you would offer a friend. Like Marnie, you're telling me that, you'd come to me at a conference because you'd feel okay, come in because I would make you feel better. But, I don't treat myself in that same regard. And so maybe, people who are going through this can think of themselves as their potential friends and family members and how they would sort of treat them if, they were coming to themselves for help or advice, what have you. And then I think ultimately, making, like Alex had mentioned, I think it's definitely more, recognized and aware now. I mean, when we were training, there was an 80-hour work week, right? Back in the day, most physicians and surgeons didn't have, they'd be on call 4 days back to back, and there was no work hour restrictions. I think there's definitely an increased awareness of it. And I think that was definitely increased even more during the COVID-19 pandemic, which obviously brought more challenges and stressors for healthcare providers, exacerbating issues related to burnout. But I think there's been sort of a overall shift in medicine in general, and specifically with, organizations. And so, for example, at Columbia University, in our department, we have a chief wellness officer, chief burnout, someone that could help, discuss burnout. What exactly does it mean? And, I know for sure that when we first started training, Alex and I we didn't have this.
That's wonderful. I've never heard of that before. Do you think that's prevalent in other institutions or health systems when you talk to your friends out there at conferences?
I'm curious to hear, Alex, if you guys have that across town at Northwell.
We do. Yeah, we do. There's system-wide, and there's a hospital-based team as well. It's been there for a couple of years, relatively novel. But, I work for a large system, and there's definitely been some focus on that over the last several years. So grateful to have that for sure.
Gentlemen, this has been a fantastic discussion. But before we go, any tips or pearls that you want to leave our listeners with?
Yeah, I guess I'll first say thank you again, Marnie. And I'm somewhat flattered that you keep referring to us in such a positive light, exuding all this confidence. I'm not sure, personally speaking, I agree all the time, but I do think it's a really fascinating and important topic. I think one thing that we haven't touched on is the concept of gratitude, power of gratitude as a practice, and taking ownership over your ability to be grateful and improve that skill set. There was a quote I recall hearing I didn't fully grasp when I first heard it, but I think it's developed some more meaning to me over the last several years, is that gratitude is the antidote to fear. So if you're afraid of something bad happening, if you're focused on the worst possible thing that can happen, if you're presented with some challenge, that's obviously a huge confidence killer and potentially would affect your performance, not to mention that external perception of your own understanding of that confidence or aptitude. So I think for me personally, if someone had told me 5 or 10 years ago, the power of that, and to be mindful and to remember how lucky we are to do, just to be walking around on planet Earth, right? But also to have this amazing profession. It's really a gift. And to try and view each potential challenge as an opportunity to use everything that you've learned and all these amazing things that you can do, as opposed to be afraid of the negative things that can happen. So to view a problem as an opportunity and be grateful for that as that opportunity, because you're in this wonderful position to be able to do something meaningful.
Yeah, I love that as well, Alex. Tough to follow that one. Marnie, again, thank you so much for the honor of inviting Alex and I to join you on this podcast this afternoon. I would say 3 takeaways that I would recommend for listeners out there. I would say A, set realistic goals. Maybe start with small, achievable, sort of low-hanging fruit that you can build on. Each success, no matter how big or small, can help boost your confidence. I would say B, focus on your strengths. Even if you don't have a ton of strengths, remind yourself of them regularly. Acknowledge what you've achieved in the past and the skills that have helped you get to your successes in the past, and don't just dwell on the negatives. And then ultimately, I would say, and I kind of touched on this earlier, practice self-compassion and be kind to yourself and avoid harsh self-criticism. Treat yourself with the same, respect and understanding and support that you would offer your friend or your family member.
This has been an amazing discussion, and I really thank you both for your heartfelt thoughts on this topic. For our listeners, if you want to learn more about Drs. Alex Butler and Nana O. Sarpong, please check out their bios in the show notes. Alex, Nana, as always, what a pleasure.
Thank you, Marnie. It's been a pleasure. Nana, take care. Good talking to you.
Marnie, awesome. Alex, awesome. Look forward to hearing this later, and I'll see you guys soon.
Thanks for listening to Connect to Develop. You can find more interviews and Marnie's Minutes on my YouTube channel at Marney Reid Presents.